Has someone told you PRP therapy doesn't work or that it's just expensive snake oil? Is PRP not covered by insurance because it's unsafe? Or have you read that PRP can cause cancer? What if everything you've heard about PRP is wrong? Could believing these common PRP myths keep you living in unnecessary pain? Hi, I'm Dr. Heather, and in this video, I'm going to debunk the top 5 myths about PRP or platelet-rich plasma and give you the truth backed by science and my own clinical experience. As you know, there's a lot of misinformation floating around on the internet, alongside myths, outdated science, and plenty of uninformed opinions, and PRP is certainly no exception. So right now, let's set the record straight, separate fact from fiction, and debunk some of the most common myths I hear about PRP. But first, just so we're all on the same page, what is PRP? Platelet Rich Plasma, or PRP, uses concentrated healing factors from your own blood, specifically platelets, to activate your body's natural healing process. During a single outpatient visit, we draw a small amount of your blood and spin it in a specialized centrifuge to isolate the platelet-rich plasma. Then, using precise image guidance, we carefully inject the PRP into damaged areas, stimulating immediate natural healing. This safe, non-surgical treatment effectively helps relieve knee pain, back pain, neck pain, shoulder pain, and more. Sounds simple, right? Well, in fact, it is fairly simple and straightforward when used properly by a well-trained, experienced, and certified regenerative medicine specialist. But as with many legitimate regenerative medicine therapies, PRP often gets mislabeled as snake oil, or worse, despite clear evidence to the contrary. So let's tackle this misinformation head-on right now by debunking the top 5 myths I regularly hear from my patients about PRP. Myth number 1, PRP is just another temporary fix like cortisone injections. The truth is, unlike cortisone, which chemically reduces inflammation temporarily and can weaken joint tissues and tendons over time, PRP actively stimulates your body's own healing mechanisms and combats inflammation at its source. According to multiple clinical studies, PRP treatments significantly improve tissue regeneration and provide lasting pain relief for 2 to 7 years or longer, depending on patient factors and lifestyle. In addition, the way we perform PRP procedures at the Regenerative Institute provides an overall improved environment to the entire structure, making it stronger and more stable. We call it giving your joint or spine a new normal. Myth number 2, all PRP treatments are extremely painful and require a long recovery period. The truth is, although some PRP injections can be painful at the time, depending on the area being treated, typically the discomfort is very manageable and short-lived. Most patients report mild to moderate soreness or stiffness afterward, easily managed with ice and rest. The first few days after having a thorough PRP treatment to a body part can have some pain and swelling of the area that's been treated. This is expected as the first phase of the heralding of healing, what is called an acute inflammatory flare, which is the initiation of recruiting the additional healing factors your joint or spine need to interact with the PRP to allow a long-term result. A clinical review published in the American Journal of Sports Medicine confirms that patients commonly return to regular daily activities within days and notice significant improvement within 2 to 4 weeks. Far shorter and way less intensive than surgical recovery. Myth number 3, PRP therapy isn't scientifically proven or widely accepted by medical professionals. The truth is, PRP therapy is backed by extensive research with over 10,000 peer-reviewed studies listed in medical databases like PubMed. These studies consistently validate PRP's safety and efficacy in treating various conditions, from arthritis to ligament and tendon injuries. It is recognized and widely utilized by leading orthopedic and regenerative medicine specialists worldwide. Myth number 4, PRP treatments increase cancer risk. The truth is, there is no scientific evidence or clinical data linking PRP therapy to an increased risk of cancer. Extensive studies reviewed in medical journals have confirmed that PRP treatments are safe and do not promote tumor formation or cancer progression. On the contrary, PRP is widely recognized and safely used in regenerative medicine precisely because it leverages the body's own healing processes without adverse systemic effects. And myth number 5, PRP is not covered by traditional health insurance because it is considered voodoo science. It is unsafe. The truth is, PRP is not typically covered by insurance due to classification as experimental by insurers, not because it's unsafe. Numerous peer-reviewed studies clearly demonstrate the safety and efficacy of PRP. Insurance coverage often lags behind clinical acceptance, especially for newer regenerative therapies that don't fit traditional insurance models. PRP's widespread acceptance among medical professionals highlights its safety and effectiveness, irrespective of insurance policies. To sum up, PRP is a safe, scientifically supported regenerative therapy that effectively relieves pain and promotes natural healing, despite common misconceptions. But PRP is not necessarily the ideal solution for every condition. If you're curious whether PRP might be a good option for your specific situation, text us at 239-323-5509 or click the purple button on this page or use the link in the description to schedule your appointment. If surgery has been presented as your only solution, let's see if PRP can offer you a better alternative. And if you know someone struggling with chronic joint or back pain, please share this video with them. It could dramatically improve their life. Thanks for watching. I'm Dr. Heather, and I'm here to help you live your best life ever.